time now.
Okay, so first, welcome to the people who are joining us. This is our little working group, little but powerful. So what we're going to do is first you will have an introduction of the project by Jan about how did we, well, why is this working group, why does it exist? So Jan, please.
Okay, thank you, Marie. Can you have the first slide? Welcome to this meeting, all. And we are going to present ourselves in a little while, I guess, Marie. But I would like to start first with a little history of this project. The idea of serious gaming as a tool to strengthen public health professionals was more or less born after the unforgettable presentation of Ola Rosling during the opening of the 10th European Public Health Conference in Stockholm in 2017. And a little bit after that, in December, in the cold December month of 2017, during the International Conference of Public Health in Wrocław, Poland, further ideas were emerged for finding new ways for capacity building for public health professionals and knowledge transfer. During the working group, in fact, after approval of a project, Serious Game for Public Health, by the EUPHA board, this working group was installed and is established from November 2019 to November 2021, with the possibility of continuing, of course. And in the same year, so it's 2019, in Marseille, we concluded it would be very nice to expand the working group with younger health professionals. And now we are in 2020, after a little bit disastrous year when it comes to working with the goals that we want to achieve. But we made a lot of progress, especially in the expanded working group. And we are now here with the first version of the Serious Game. And it's only a first step. It's only a very draft one, and it has only, we have a lot of ideas, but we like to share it with you now, and we like to discuss some things when it comes to serious gaming with you. And I'm very glad that we have some people in the room that can have added value to that. Next slide. What are serious games? Now, well, you can find all kinds of different types of serious games: physical board games, online video games. You can think of escape rooms. Recent scientific findings show that the potential of serious gaming in public health professionals could be an added value in social learning, in capacity building. It's extensively described in literature, and evidence has been compiling the last decade. So we are very pleased to have this project together. Next slide. Who are we? Well, this is the working group at this moment. And I'm Jan Jansen. I'm a public health advisor and a freelance EUPHA advisor. Marie, what do you suggest? Do we now make a short round to let people introduce themselves? Okay, you're muted, Marie, but that doesn't matter because I saw on your face that you agree.
Yes, I agree. So, and we should start with Dineke because she's first on the list.
Exactly. Yes, I'm Dineke Ziegers-Paget, Executive Director of EUPHA. And the idea of serious gaming came in Poland when I met Jan there in cold December, but we were quite warm inside. And the idea basically is to provide our member associations, so national associations of public health, with easy tools to engage in capacity building and skills building.
Dineke, can you also introduce Maaike, please.
Well, I'm not Maaike, but Maaike is my deputy director, has been very, very enthusiastic about this serious gaming group like me, and has been leading it for several months this year as well. Unfortunately, she's busy at the Congress, as you can imagine, so you won't see her in person here.
Iveta.
Good morning, everybody. My name is Iveta Nagiova, and I'm the president of the European Public Health Association. And I had the pleasure to join this group as well. And why I like it is because I'm very much interested in knowledge translation and translating knowledge into policy, but also to practice and also in capacity building. And I'm always looking for new ways how to do the translation of knowledge to all these groups, actually. And I also myself like to play, so I think it is a nice combination. I mean, computer games, I used to do that in the past more often. Now I don't have time anymore for that. But I really like the challenges, and I really like all the new options. So it's a pleasure to be here.
Yeah, good morning, everyone. I'm Pasquale Cacciatore. I'm a representative for EUPHA, which is the network for students and young professionals within EUPHA. As Iveta, I'm also a big fan of gaming, but I've never engaged in any serious gaming before, so I'm open to the challenge. I think it's a great field to discover and work on.
Jan or Dineke, can you please introduce Luis?
Yes.
Dineke, can you do that?
Yes, of course. Luis Saboga Nunez is the president of our EUPHA Health Promotion section and has been very active in the field of looking for gaming, fun ways to teach health promotion and to build knowledge of public health professionals. He unfortunately cannot be here because he's recovering from surgery.
I guess we wait with the introduction of Raisa until she's here.
She actually asked me to present her.
Oh,
so,
that's very good.
Yeah, Raisa has an MPH from the University of Porto, and she also started recently a PhD in health data science. I don't know much about how she joined the group because I arrived after her. So, but I guess she can write a short introduction on the blog on our website later on.
Very good.
So yeah, welcome. My name is Thorsten. I'm a researcher at Bielefeld University, Germany, and a PhD student. And actually my field is education and health literacy. And the reason I joined is because I'm a gamer and I spent a couple of hundred, if not thousands of hours in gaming. And I'm really interested in seeing how the potential of gaming or gaming mechanics can be used to foster skill buildings and knowledge transfer. So I'm really looking for the potential that is in connecting the fields of gaming and public health.
Thank you. I am Marie Chardon. I'm EUPHA's one of the two new scientific officers. So I joined the group because, well, it was one of my tasks, but I was actually very glad because I always play with my friends to board games mostly. Every game is serious with them, but I was curious about how we could use these games and adapt them so we can actually help people build their skills and how we can use them to learn in a more relaxed way, because we know how academics can be. Sometimes it's a bit stressful and a bit overwhelming. So yeah, I think developing games for learning is of great interest. So
thank you. Maybe I can add a little bit about why Raisa and when Raisa entered the working group, because after our discussions at the Marseille 2019 European Public Health Conference, it was clear that our working group needed expanding, especially the younger people, younger professionals, and those with an experience in gaming. And that's where we still, I think we need that as new members. So at that time, there was a newsletter from EUPHA Next asking for people who were interested in serious gaming. And Torsten, Raisa, and Pasquale have joined. Pasquale was there from the beginning, joined our working group. So that's what we are very pleased to have a working group now of these people, but we still are looking for new people. So that's why we are also here together this morning. The next slide.
I can see that Luis has joined.
Yes.
Oh, that's good.
Good morning.
Luis, good morning. Nice to have you here with us. Maybe you can add a little bit, because we are in a round of introduction. Maybe you can say a few words for yourself.
Well, first of all, sorry to be late. That's the first word I want to share with you. It has not been very easy to manage these last days, so I'm trying to keep myself up in order to function. And I'm really happy to see that we have achieved what is now available, thanks to the efforts of many of you. And on behalf of the promotion section, I hope that we can improve this game until it becomes really something very practical and useful for health professionals in the field of public health. So I think for now I will stop here, and later on, if it is needed, I can come back. Thank you very much.
And it's very nice to have you with us, Luis. So very good that you could join. Well, the working group has some aims for this project. We are trying to develop a serious game for public health professionals at European level to support the EUPHA members in skills training, including collaboration, and with those outside the traditional field of public health. For instance, urban planners and occupational therapists. Of course, this project is also there to discuss the added value of offering serious games as a benefit for EUPHA members, and we want to evaluate the developed serious game on the hand of a few indicators that we are going to construct. Next slide, please, Marie. These are the two founding members, maybe, of the working group, but it's and we have two quotes that we are very much want to share with you, because I think what Dineke said, it's good to work on gaming tools to get a serious message, of course, and what my aim also is to make it a fun and energetic way of working and learning together when it comes to serious gaming. So the fun factor and the fun approach should be there also in serious gaming. Next slide. We are here together to discuss with you and to orient on what are now new ways to make public health more interesting. If you have these technical skills, coding, game conception, drawing in your capacity, and you want to join us and you believe in knowledge translation, you are very welcome to join our working group, because we need some people who have these skills available and can be in our group for the next year. You can always contact Marie, and she has put her contact details there. But you can also find some details on the website that we are going to share with you. I think this is my last slide, or not, Marie? Yes. So maybe, Marie, you can take it back.
Yeah. So what we would like you to do is, if you have any ideas that you're not willing to engage in the working group because it can be a bit time consuming, then you can tweet under this hashtag. Actually, it's not the right one. 1 second, sorry. It's not EUPHA Serious Game, it's EUPHA Serious Gaming. So,
wow.
Yes. Okay, good.
Also, better.
Yeah, so you can use this hashtag to share your ideas. If you come across, I don't know, maybe other initiatives of other people who work on serious gaming, you can mention us and connect us to those people. We would absolutely love that. And yes, that's all. And you can take the little quiz on the website that I've shared on the conversation. Well, the little quizzes, plural. One has been developed by Yvette, another one by Thorsten, another one by Pasquale and Jeneke, another one by Louis. Everyone was active on this. So, and the website has been developed by Raisa. So it's a first idea of what we want to do, and now we're going to fish for ideas. What I wanted to do now was to ask our working group some questions, and then I will ask you to answer the same question on the Slido thing that I've published as well in the conversation. So I think my first question for you all would be, what do you think is the main challenge in creating a serious game? I don't know who should start. The most inspired one.
I don't really want to claim that to be most inspired, but I can say a few words, a few thoughts. The main challenge, I think there are a couple of challenges, of course. And I think one of the big challenges is that we are absolutely dependent to collaborate with others, with other fields, because public health, we're not natives in developing serious games or games at all. So I think it's important to acknowledge that we have the expertise in certain areas, public health, obviously, but we need others and cross-disciplinary collaboration to make it work. So that would be one, I think, big challenge. And another challenge that I see is that it's really important to acknowledge how high the standard for gaming is nowadays, because gaming is a multi-billion venture with millions or billions of people engaging in it. So I think it's really important to be very careful about developing a game that makes fun and that is not so much focused on the learning aspect, but that learning is something that happens along the way of enjoying time with others. So I think game design and development is really, really difficult, and we are really looking for collaborators on that one.
Anyone else? Okay, well, I will. Oh, Pasquale, please.
Yeah. No, just to quote Thorsten completely, I think it's really important to make sure that we do not forget the fact that this must be fun, still informative, still educational, but at the same time fun. Otherwise, it's difficult to engage with people. So it's a challenge for sure, as Thorsten say. But this would be my key message. Let's remember that it must always be fun.
Right, Mari, may I also react? Well, I was just thinking while developing the questions for our quiz, I just realized how difficult it is actually, because we are working in our fields and with some systems. I'm, for example, a researcher, and I'm used to write scientific articles and to communicate in a certain way. But when I was asked to translate the information that I'm passionate about, and in particular knowledge translation, I just realized how difficult it is, to create a quiz questions out of the nowhere, and how to make it understandable for people, how to make it attractive for people, how to pick the right information. So I think it really requires a lot of out of the thinking also, or out of the box thinking also from us, so that we understand a little bit better, and that we are sympathetic and empathetic, and that we understand that what might be interesting for the potential users of our serious game. So it is an interesting challenge, actually, I have to say.
Can I add something to that? Okay, because I think the most important challenge that I feel is how to come to a sort of blended version of the game. So it's, of course, in the beginning of our ideas, it was the added value of having a physical serious game was that you meet people, that you can interact, that you can see what others do, and that you can really work together. In an online version of a serious game, that's always a little bit more difficult. And that's why we are sort of handicapped in this period of Corona in building this game. And we are, of course, hoping that in the near future we come back to this idea of a blended version of the game. So can also have a physical aspect where you can actually meet with other people and get more out of it. That will be the challenge that I see for the coming year.
Yes, I wanted to make a similar comment that it's really about the collaboration. And obviously this year, you know, we put a lot of effort in this quiz so that people can see what you can do with a serious game and one less serious quiz. But the most important is that people start working together, that they start understanding the other side of, you know, an urban planner. What are his or her priorities? What are the priorities of a hospital manager? And then work together to find a solution. If you can have simple games for that, where you can meet in person and you can work together, and we have the ability to translate that in different languages, I think it will be an effective tool in Europe to use everywhere.
May I also add some words?
Please.
I don't have much to add to what has been said, but to put on perspective that when we enter this type of mechanism of communicating in public health or in any area, the serious game is how we get out of our box, of our very comfort zone, and enter the other's perspective on the topics that we are proposing to be handled together. So I think this jump, this knowledge translation from the scientific field to the most common understanding of things, it's the big issue that we have here. And passing by the game, I would like to ask your understanding, because there is a glitch in the health promotion quiz. So question number 2, it's not well posed, so it might create some confusion when you deal with it. It says how many OECD countries have allocated funding to health promotion and disease prevention in 2015. So I want to apologize that this is not the right question. The right question is how much spending on healthcare functions have been done by the OECD countries. So the right question would be how much OECD countries have allocated to health promotion and disease prevention in 2015. Why do I raise this? Well, for your understanding, of course, about the little correction that we need to make here, but to emphasize how really far away we are from the social representation of what is going on in our world today, and actually what is in our minds as scientists and researchers. So for scientists and researchers, the gaps that we have here could be a nice way to interact with people and make the process of knowledge translation much easier. So anyway, to begin with, I think this is a very, very wonderful step that has been done. And to achieve what has been already done, it's really amazing. So thank you for all the team that has been able to put this up.
Thank you, Louis, for sharing that. Everyone, so we have a question in the Q&A section. Someone is asking, will the first focus of the working group to develop a game to encourage intersectoral public health knowledge Is the first target group public health experts or people who are not working in public health at the moment? Can anyone in our group answer that?
I answer that. Our first idea was to develop a tool that our national public health associations can use to build the skills of public health professionals. But in the first discussions in the working group, it was straight away like, no, 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 we have to think much wider. It has to include other professions. It has to include maybe, the general public. How can we include them as well? So it's very broad. And when you start discussing it, it can go in all directions. So we probably have to set priorities. The first is to teach public health professionals maybe on how to communicate, how to translate the knowledge. And then we can go a step further and a step further. And I also think we need different tools for the audiences we are trying to reach as well.
Yeah, I thank you for that answer. I just wanted to personally react on this challenge question. I think one of the main challenges is to actually there are Torsten said that it's a very big industry and there are many games out there. So how do we what is our what makes us unique? What do we provide our target group with, and how do we keep, how do we make them own this game? How can they pass it on and improve it? And yeah, so I think everything is to do. As Iveta said, it's hard to develop questions. It's hard to find the right tools when we are not, gaming professionals ourselves. So this is why we need you all in the audience if you have that kind of skills. We have a question in the chat from Tara. Has there been thoughts on how to tackle the challenge for creating a game that can be used across the different public health systems across EU?
Yeah, let me try to respond to that. So there have been lots of discussions and lots of meetings on how can we make it work and who should be the target group. And I think one of the key challenges that was raised or that was discussed is that it's oftentimes difficult for health professionals or researchers to communicate clearly and to really communicate to the public, to get the information across. And I think that is a challenge that is universal maybe and not dependent on specific health systems or different public health systems as it was phrased here. So I think there are contents that might be transferable and that are not specific to different public health systems. So at least that would be my take on that question.
Yes, Thorsten, that's a perfectly correct answer. I would say exactly the same things, that there are topics and that there are knowledge in the field of public health which are universal, which can be universally applied to any country, to any system. So there are really some things, even health promotion, for example, you can learn a lot of things just by very general knowledge or information. Sorry, I lost myself in this answer, but I hope that you understood what I'm trying to say.
Yeah, absolutely. And what we also discussed was the topic fake news. So how can we go about fake news? How can we challenge that with evidence-based information? And I would be really surprised if there's one country that is not affected by fake news. So this is a universal problem nowadays. And so I think it might help a lot of people in a lot of countries.
And to add to that, it could be an interesting thing to think about in the next months for us to see if we make and develop a game that you can build in something that makes it easy to change the look and feel of the game when you are working within these different systems. So that could be something that is a sort of plus to the game, that you can change it to the and change something in the look and feel of the game to make it more fitting to the public health system that you're actually working in. But that's something for the second stage of the game, I guess, because like Torsten and Iveta said, we're now starting from the more generic approaches when it comes to communication, fake news, working together, and knowledge translation.
Yes, but actually this is to me also a kind of like brainstorming meeting. And,
Yeah.
you know, when we are just discussing about this, I realized, reflecting on Torsten, that fake news and also the way how, for example, we communicate the messages as public health experts, you know, how to design, let's say, leaflets or how to shape our messages. I think this is also a new type of information that public health experts do not really know and are not really aware of that it comes, for example, from behavioral insights and sciences field. And I think this could also be one of the options for, you know, for this serious gaming, because there are some groups who are already testing these kind of things. For example, the behavioral insights team from the US, they have a dedicated website where they are testing different types of posters and how people react on them. What is the comprehension? What is the understanding? What is the recall of the information? So this is really something what challenges me now. And I think it is also one of the topics which is very important and relevant for the public health group.
Absolutely.
And you, of course, also have the Gaming for Health Europe. It's an association based in the Netherlands, and it organizes a congress every year. And that is really to display, showcase different ways of gaming. Most of them are aimed at care, healthcare. So how can you care for somebody who has dementia, or how can you get somebody who has, you know, paralysis to move again? But we're trying to include more and more public health there. And it's a very nice conference to go to if you're interested in gaming and health, because you really learn a lot from the different presenters.
Thank you for all of your insights and reflections. That was very interesting. I do have another question for you all. Do you have a favorite game that you think, or not, maybe not a precise game, but a sort of game that you would like to see translated into a serious game? I know Iveta has many things to say about that.
Well, I'm not sure what are many things, but definitely there are several types of games which I like, and I'm not really a big fan of some adventure. I mean, some action games, so shooting and things like that. But I really like more kind of like puzzle games and logical games. So I really like the point and click adventure games, and I think this might be feasible also for in the field of the public health. So just to describe you how it looks, you have a screen and then you have some puzzles. You have to look for some objects or answer some questions at this page, and then if you solve the problem, then you can move to another screen or another field. So basically it could be also a kind of like escape room. So this is something what I would really like to see. And you can have there also some videos. I don't know whether somebody of you know the game Siberia, for example. It sounds strange, but it is the French game, old one, but a very nice one. So and it has a very nice atmosphere, you know, even if it is just screens and point and click, you still can have a feeling that you are in the movie, for example. So this is nice. And another thing which comes to my mind, but it is a bit more complicated, is having lectures or conferences in Second Life. It is the kind of like emulation of the reality. So you enter a virtual world actually with your avatar, and it exists. You can follow lectures there, conferences, but it has quite high requirements for computer facilities. So I think this is not, at the time being, not really relevant for our community. But I'm really dreaming also about these type of things where you can enter with your avatar, you know, and to interact. And, you know, I can have a kind of like substitute for this type of conference, which is still very nice. I have to say this platform is interesting and it creates a little bit the illusion that we are at the conference. But, you know, you still miss this feeling that you are really there. So for the future, maybe we are going to have some glasses also and some other technologies that we can use for real gaming. I don't know.
I would just like to continue Iveta's thought on Second Life. For some years now, I have been involved in an experience in Second Life where you know, you have to buy a land, then you build a building, then you have your meetings in that land and people come and meet with you. And this was an experiment, I would say a serious game experiment on this Second Life environment, focusing on the issue of smoking cessation. And what I would like to share with you is that I had to stop the experiment. This was some years ago. I have something written about that. If you want, I can share with you. But I had to stop this game because the demand was how can I say, was much more higher than the capacities I had to respond to the participants. So one of the issues of these environments on gaming, I would say, is the networking process and group activities. So I would be very happy to regain again this Second Life experiment, make it available for you. Of course, I have to buy again the land and start the process. But one thing that I noticed is that people came from all over the world. And then I had the language issue because some of them wanted me to speak in French, some of them wanted me to speak in Portuguese or in English, and there were other languages. And then the interaction was absolutely amazing because, and then this I learned from also the AA, you know, the Alcoholics Anonymous, you know what I'm talking about? Okay, so the Alcoholics Anonymous has also been using Second Life for this. And what is their experience is that people are really much open because when they are using an avatar, they can talk totally freely and they feel completely immersed in this environment without any, you know, masks on their faces to deal with their issue. So they can open up much easier. So I think that what we are doing now with our serious game is very in line with this kind of issue. And I'm pretty sure that we can link different other components to what we have now and expand from here to other domains. And for me, Second Life is definitively a very, very attractive platform for this kind of thing. But be aware, you have to control yourself in Second Life.
Yeah. I really like the team building games. One thing is the public health escape room, and in Marseille, of course, we had the board game of escape room on an infectious virus outbreak, which was really nice because when you walk past the room, people were laughing after the escape hour where they didn't escape, but you know, they were let out of the room anyway. So, but then they kept talking to each other, and I think that is really something we should aim for as well. And one thing is, which I've always dreamt of, is the escape room for public health in different formats. And the other one is what Maria Bacola also said, is you know, a board game where you have to start working together. So I would really go for the team building.
I like that. I like Maria's idea and the fact that it should start conversations at the same time. I mean, we have different options, but you know, starting the conversation and arguing about what would be the right answer so the team can succeed, I think it's what we are aiming for. But also we know that now with this all online things, maybe we should adapt and maybe we should have two different games, one that you can play basically alone and progress in. So I told the working group last time about this. It's a sort of an app and you have to tell someone what to do. So this person is in space and you have to guide this person. So, but I was thinking maybe we could have one of the fellows and we can, you know, tip them and they ask us questions. So this would be more like an individual game in which you progress by yourself. But yeah, starting a conversation is also very important. So we should keep that in the back of our minds.
One of the remarks that are now in the chat is that we maybe should build a platform where everyone can participate. So it's not restricted to public health professionals, but to a broader public. I think it's an interesting idea to bear that in mind if we are going to proceed with the actions of the working group, to not per se have it focused only on the public health professionals. So I think it's a very good idea, and we take that with us.
Yeah, enough. If I can add to that, I think I thought about that for quite a time. If it would be better to have a dedicated public health game for a rather limited audience, or if it would be better to, let's say, include public health themes and topics into games that are broadly accessible. So I think that would make a larger impact at the bottom line if, let's say, 1 million people play a game where there's some sort of public health knowledge and principles in there. And also what we've got in the chat is another comment. It could be like a monopoly going forward by answering questions and having an award, which could be the registration at the next EUPHA Congress. Yeah, we actually talked about that to like win a waiver for the next conference. So yeah, great idea too.
I really like the idea of trying to get public health into existing games already. So games that children are playing and they're really, you know, they have like this fighter on screen, and my kids are older than that. But that might be really nice that, for instance, if they eat something wrong, they're slower because they got the fatty food instead of the healthy food. But that means you have to sit around the table with the game developers and persuade them that this is a very good additional learning aspect of their game.
Okay, well, thank you for all this. We have another comment. Games that promote pro-social behavior would be good. Definitely.
Especially in this time, we need that very much. For instance, in the Netherlands.
Not only in the Netherlands, I would say, unfortunately.
I just thought about the aspect of pro-social behavior, and I thought about games that promote that already. And I think it's really a principle in games that you play together with other people. Like I was thinking about World of Warcraft. It really has to be acknowledged that there's let's say, really a society in the game that is highly organized and highly structured. And there are, let's say, not your family, but there are groups to which you belong. You've got really an official function in there. And I think this works only by communicating and by acting pro-socially. So I think the aspect of acting or promoting a pro-social behavior is already included in a lot of games that really need the cooperation, which you cannot play alone.
Yeah, again, I would say it's a challenge when you have to build something online in these times, because just the fact of being virtual itself is already a way to get everything more complicated. If you're in an escape room, it's so easy to build some kind of pro-social behavior. You know that you are going to work together, and then you end up, after escaping from the room, hopefully, you get this sense of accomplishment in having worked together. So how difficult it is right now to convey the same message while being virtually sitting in front of our monitors. So I think it's even more challenging, but probably because of that, it's more interesting too.
Yeah, and maybe picking up on one comment in the chat, adding a voice chat can help on the game, and also what has been said before. This brought a game to my mind. It's called Keep Talking and Nobody Explodes. So one person sees a bomb and can rotate it and see what they communicate to the others what they see, and the others have the bomb diffusing manual. So one person really has to share what they are seeing, and they are totally dependent on the others. And the problem can only be solved together and by communicating and by using voice chat. And maybe that sort of principle can also be implemented using a public health theme. 。
So we have a comment from Tim about the gaming industry. He says that the gaming industry learned that having players who are too antisocial are off-putting to the majority of players. So you can put activities in the game that promote this and change these features as you develop it. And you can also have consequences for those who are not pro-social enough. I think this is a good idea. You should interact more, you should share more. It's not individual because public health is collaborative, so you should collaborate with others. I think this is a great idea. And within a game, you can experiment with interventions that try to alter player interactions. I have no clue what this means. Someone can explain.
Well, I think it's about rewarding pro-social behavior and punishing, let's say, how to put it. I think there are toxic players out there, just like they are in society, that are aggressive, that are abusive in their language. And in the games that I know, there are mechanisms to report these people, and then they get a ban for, let's say, 3 days, and they're saying, hey, what you said here in the chat was not okay, and please think about that. I think this can be more than just a punishment and be connected to, let's say, trying to really improve pro-social behavior.
Okay, well, thank you for the great comments, Tim and Maria and Lewis. It was very helpful. So if you're interested in, participating more, send an email, tweet and stuff. So we would be glad to have you on board. I don't really have other questions for you because you sort of answered them along the way.
Maybe, Marie, it would be nice if we can put again a slide for the people who joined the room, like the last slide you had with your email, the hashtag.
Sure. It's here. Everything is on my screen. Okay. Yes.
Yes, thank you.
But my email address is not on the same. It's here. And if you email me, I will, of course, forward it to all of the other members of the working group. If you have any questions, now is the time. We still have 10 minutes that we can use. I see there is a comment. Happy to share email. Thank you, Tim.
Yeah, maybe I can add something very, very general, because I thought about serious games and I was kind of convinced that I've never played a serious game before. I was thinking I've played games for entertainment. It wasn't a serious game. But then I really started to realize that lots of the games that I've played and enjoyed were in fact some sort of serious games, because I've played 10 or 15 years ago a game called Theme Hospital, where you manage a hospital, for example. And it was gadgety, it was humorous, but still you have the task of organizing. And also what I played was Wii Sports. You might know the one where you play tennis with this controller. And I think that's a health promoting activity, not one where you like promote knowledge, but certainly some sort of behavior or movement. Or also then Pokemon Go, the one, I don't know, you might have noticed this a couple of years ago.
Yes.
To really pick up this game and get outside and move and don't come back to their home for hours. And I think that was probably the best public health intervention that there was in the gaming industry. And I don't even know if that was the purpose of that, but still it had the effect. So I think there are lots of games with public health or health promoting aspects in them, which are not labeled as such. And I think that's a great thing.
Of course, the aftermath of Pokemon Go was that small children were in very dangerous situations, crossing big streets to get their last Pokemon. So it had an
and gardens of certain people were destroyed because there was some very special Pokemon type in it, and hundreds and hundreds of children were rushing into the garden. So that's, well, they actually were moving. That's a positive thing.
I think we have many options to explore. The hardest will be to pick one idea and develop it until the end. And this is I think the main challenge is to just make a choice, because as we said, we can explore board games, we can explore games like Pokemon Go if we want people to go outside and meet. We could have something where people leave, like, I don't know, questions in the streets, and others, while they're walking, they can just answer. We have so many ideas and they just keep coming. It's a bit exhausting. But I'm confident that we will find something that we can develop and present next year. A really well prepared and I don't have the word in English, sorry. But yeah, I'm sure we will have something by next year.
Yeah, Mari, I have a question. Maybe I'm not sure whether we still have some time. I'm looking at the time, but the people who are attending this meeting, did they check our website and did they try the quiz? I'm really curious about some feedback. How did they like it or what they thought about it? It is in very early stages, but still I would like to know how we can do better.
Yes, well, if you have Twitter, the people who are in the chats, then please share your feedback about the quizzes on topics like, did you have fun, and did you learn something, and how do you think it could have been better? Try to organize a little bit so it's not just it's lame or it's excellent, because there is no in between.
Well, maybe not publicly on Twitter. Not to humiliate us. Maybe send us an email. I don't know. I'm just joking. But yeah, I think it would be nice to have more people in the team, because I really enjoy, for example, listening to Thorsten or to some other people who have, different view, different angle, different type of thinking. And this is so refreshing, actually. This is what we need for the serious gaming group.
Do we have any more questions, comments from either, well, you, the panelists, or the audience? Doesn't seem like it. Well, it was great having you all here and share ideas, and hopefully we will have new recruits in the upcoming weeks. And I'm going to just stop the recording right now. No, I will do that later. Sorry, thinking out loud. Well, thank you. Enjoy the rest of the conference, the Congress, and I will see you soon.
Lovely. Thank you very much, Mari.
Thank you.
Thank you, Marie.
Thank you.
Bye-bye.
Bye-bye, everybody.
Goodbye.
Have a nice day.
Bye. Have a nice day.